I'm Dr. Andrew Elkwood, plastic and reconstructive surgeon with an interest in cosmetic surgery, and I'm here to answer your questions.
Well, the best thing you can do is listen to your surgeon. We'll give you specific instructions on what to do and what not to do when you get home, and make sure that if you have any problems or questions that you communicate them to us as soon as they arise.
Some brow lifts need to be repeated, some brow lifts not. For the most part, we're very cautious about repeating surgery around the eye, and that includes the brow, because the eye itself is not just a cosmetic organ, obviously it's a functional organ.
Recovery for a brow lift procedure is pretty straightforward. Pain is not a major issue. There may be some discomfort where the incisions are made.
You're swollen for about a week or so, which doesn't imply that you're bedridden. You know, patients are up and moving around the next day or so.
Most patients will complain that for the first several days they feel a lot of tightness in the forehead and the scalp region, which is what we want because that's what we're doing. We're lifting up the brow.
At about 2 weeks, you'll be feeling pretty good, and at 3 to 4 weeks, you'll be looking fantastic. We like to limit travel just because there are frequent post-op checks in the initial period, at least for the first week or so, and after which you'll probably be able to be released.
In my practice, I have people take about 6 weeks from any strenuous activity that might increase your heart rate and otherwise increase the blood flow to your face and head. I do also not want people for 2 to 3 weeks to be doing any sort of activities that involve bending over. So if you have a job where you're constantly bending over, for instance, you're a yoga instructor where you're doing downward dog all day, I'd ask that you maybe take a longer leave of absence from work